Group 5, Vinny, Stephen, and Lena, and the Free Clinic of Southwest Washington provides free healthcare services to individuals who lack insurance. We conducted a survey to learn more about the people who use the Free Clinic and assess the quality and satisfaction for the services provided.
There were a total of 126 patients surveyed. Our class divided them up into 5 categories based on the type of services provided.
The 5 groups are evening medical, morning medical, health, screening, dental, and immunization. Although we analyze the entire data set, our primary focus is dental.
In the 6 patients surveyed for the dental group, we found that all of the respondents were located within 15 miles of each other. When analyzing the clinic as a whole, we found that most patients resided in the 98661 zip code, which is where the clinic is located. 5 out of 6 patients that went in for dental work said English was their primary language. In total, 96 out of the 126 patients surveyed spoke English, although we found that there were a number of other languages listed. These included Ukrainian, Czechese, Hindi, Islander, Korean, Japanese, American Sign Language, Russian, Somali, Vietnamese, and Spanish. We found that the predominant foreign language was Spanish, with 30 patients who spoke it as their primary language. 77% of the patients surveyed drove a car as a primary mode of transportation. 10% said that they relied on public transportation such as the bus, and 8% said they walked as their primary mode of transportation. In contrast to this, 100% of the dental patients surveyed had a vehicle. In the dental group, 1 of the patients was under 18. 2 were between 25 and 34, and the other 2 were between 35 and 44. Similarly, most of the 126 patients surveyed were between 25 and 34. That accounts for about 23% of the sample. For both the dental group and the entire sample, we found that about half were currently employed. Of those who were employed, about half worked full-time. Our analysis of all 126 respondents showed that 87% did not have health insurance. The dental group was slightly different, with 66% lacking insurance. One of the respondents who had insurance, they said that dental was not covered. Since the ACA took effect in January, more people do have access to insurance. However, there are some people whose income bracket still does not qualify them for state insurance. Furthermore, they are unable to afford private health insurance due to other financial obligations like debt, medical bills, rent, utilities, and other living expenses. Regarding the people who said they do have health insurance, for the most part, it is unknown why they are using the free health clinic rather than a regular clinic. Although one of the respondents in the dental group said they had trouble applying for Washington's Apple Health, it is possible the wait time was less than dental providers for state insurance. The ACA has created an excess demand for clinics that accept state insurance. It is not uncommon for wait times in Clark County to be in excess of 2 months. It could also be that information regarding the changes to healthcare as a result of the ACA aren't able to reach the non-English speaking population. There was an additional satisfaction survey conducted, in which 64 people participated. The first section of the survey asked participants to rank the quality of service at the free clinic on a scale from 1 to 5, 5 being 100% satisfied. The average for quality of service was 4.89 out of 5. The lowest score was a 3, and only 1 person gave the clinic that rating. The next section was quality of life after care. The average score was 4.83. The lowest score was 3, and only 3 people gave that rating. The last section asked how knowledgeable they thought the clinic staff and volunteers were. This is where the clinic staff got the lowest average of 4.75, with a range of 1 to 5, although only 1 person gave a rating of 1. Our analysis shows the free clinic is doing an excellent job. They received great feedback in the satisfaction survey and are a valued part of our community. We recommend that they continue to deliver the level of service, care, and expertise that they are currently providing.